Hi, everyone. This is Camilo Mejia. I am the Director of Policy and Advocacy at Catalyst Miami, and I'd like to welcome you to our Met Talk today, which will be about Medicaid expansion. This presentation is brought to you by the Center for Independent Living of South Florida and Catalyst Miami in partnership with the Enable Project, a coalition of organizations working together to create access and inclusion in Miami-Dade County. For today's presentation, we're going to have two great speakers. The first one will be Dr. Elias Moises Moron, who is a clinical assistant professor at Nova Southeastern University College of Dental Medicine. And he's also a research consultant at the Hispanic Dental Association. Dr. Moron's diverse professional experience includes private practice, healthcare administration, public health, health law, teaching, and research. Over the course of his career, he has worked with people experiencing homelessness, people with substance abuse disorder, people living with chronic mental illness, and people living with HIV. Dr. Moron earned his DDS from the Universidad Metropolitana in Colombia, a Master's of Science degree in Health Services Management from Universidad del Norte in Colombia, and a Master of Public Health from Nova Southeastern University, and a Master of Science Health Law from Nova Southeastern University. He also holds a certificate in health auditing from Universidad del Norte in Colombia, advanced education in dental public health, postdoctoral specialty from NYU Langone, and a certificate in principles and practice of clinical research from Harvard University T.H. Chan School of Public Health. The other speaker that we have today is Scott Darius, who is the Executive Director of Florida Voices for Health. Scott graduated from the University of Florida College of Law in May of 2013. He also completed his bachelor's degree at the University of Florida with a major in political science in 2010. As a law student, he focused on health policy, insurance law, and social justice issues. He began his career in health advocacy in 2012 when he joined Florida Chain, where he eventually helped to coordinate a statewide campaign for Medicaid expansion. Scott has always had a passion for healthcare issues and hopes to be engaged in the process until quality, affordable care is truly available for everyone. This workshop is very important for us because we are, as you may know, one of 13 states that has not covered the Medicaid gap, which means that we have about 500,000 Floridians who don't make enough money to qualify for the Affordable Care Act, but make too much to qualify for Medicaid. Therefore, this workshop aims to educate the community and also our elected officials about the benefits of expanding Medicaid in our state, not only from a clinical perspective, but also from a social justice perspective. We hope that you find it very useful. Thank you.
So yeah, just to quickly pick up, we are thinking about or talking about just how restrictive Florida's eligibility is for Medicaid. You can see here that our program, as is, does a decent job covering children who are in and around poverty. We also cover pregnant women almost up to 200% of the federal poverty level. I think it's worth noting that the state recently passed a postpartum extension that allows new moms to stay enrolled in Medicaid for up to a year postpartum. And we know just how important that is. But one group that sticks out on this chart is looking at parents and caregivers. And that brings us to what we're actually talking about today when we say the coverage gap. Now, the people in the coverage gap are actually those parents and caregivers and single adults who are left out of Florida's Medicaid program altogether. First of all, in Florida, you have to be a parent of a dependent child to qualify for Medicaid at all. If you're a single childless adult, regardless of how little you make, you do not qualify for Medicaid in Florida. Now, if you're a parent, you're eligible but only if you don't earn more than 31% of the federal poverty level. Now, you can imagine just how limiting that is. That means that in a family of three, a parent can't earn more than about $7,000 for the year and qualify for the program. Now, for those working parents, particularly those who are working in the fields that are in careers that are basically the backbone of Florida's economy, who earn between $10,000 and $30,000 for the year, they often find themselves earning too much for Medicaid, but too little to qualify for tax credits in the ACA marketplace. Last bit of research we saw, there's at least 425,000 Floridians who are squarely in that coverage gap. But for the last 10 years now, Florida has had the opportunity to change this. When the ACA passed, it required states to expand their Medicaid programs to cover more people. In 2012, the US Supreme Court ruled that although the ACA was constitutional, Medicaid expansion was optional for states. Now, over the last 10 years, we've seen 38 states, and actually 39 after the results in South Dakota last night. We've seen 39 states take up this opportunity to expand. Florida and, perhaps not surprisingly, a lot of the other southern states remain among the last holdouts. Now, I think there are two reasons why the experience of other states is important. First, states are allowed to back out of Medicaid expansion if the federal government doesn't hold up their end of the bargain. And I think it's telling so far that none of those states to have taken on expansion has actually backed out of the program yet, meaning they haven't found, a bad partner in the federal government and have had the excuse to walk away. Second, we've been able to watch this experiment play out in these 38 other states, and it's given us a pretty good idea of what it'll mean for us here. I think one of the biggest takeaways we get watching other states that have Medicaid expansion is how much money you actually save. Now, according to our really good partners over at Florida Policy Institute, as a state, we stand to save over $200 million a year just from eliminating the patchwork programs that we have, reducing the amount of high-cost care that we deliver in emergency rooms, and really investing in the prevention side of medicine. I think those savings are also fueled by the fact that the federal government would match what it puts, the dollars we put up for Medicaid up to 90%. The current split is 60-40. So, we have a total amount that Medicaid costs the state, but the state is only actually responsible for 40% of it, and the federal government provides the other 60. Under Medicaid expansion, that split becomes 90 from the federal government and 10 from the state. We also know that Medicaid expansion would bring in billions of dollars into the state from increased economic activity, but also just from direct federal incentives, like an additional $3 billion we would get from the American Rescue Plan just if we passed expansion. So it's a $3 billion check just for saying yes to the program. So really, when you take all of this into consideration, the bottom line is that it's fiscally irresponsible not to expand. Now, I'll say this, that I always start with the economic argument because we know that it's where, a lot of people, but especially elected officials, eventually take the argument. They say, oh, it costs too much and it's why we can't do it. And it's nice to get that one right out of the way. But I think at the end of the day, and the reason we're all on this call is because we care about people and we recognize that this is just about getting healthcare to the people who need it to live full, happy, and healthy lives. Now, nearly 500,000 people who, I think Medicaid expansion gives that nearly 500,000 people who don't have any options for healthcare a little bit of relief. This is something that would kind of step in that gap. Now, unfortunately, like we've talked about a little bit, our current healthcare system, it tends to impact some groups more than others. Some people are just kind of left on the outskirts of it more than others. In Florida, there's actually a lot of different groups you can look at. For the sake of time, I'll just focus on the benefits expansion would have for rural Floridians, but also among Florida's communities of color. We know expansion would go a long way towards reducing the number of uninsured people in metro and rural areas, but we know we see that currently those living in rural Florida are much more likely to be uninsured. I think the same is true in communities of color where you have high healthcare costs, which can often be traced back directly to systemic inequities. And now we have over 50% of Floridians who are in the coverage gap are actually people of color. So that's just to say that there are some, we know from our own experiences that there are communities that are disproportionately affected, and Medicaid expansion is one of the bigger tools we have in our pocket as we push for health equity. So obviously Medicaid expansion is still an option. And more important than that, I think we have a coalition of organizations and individuals who are committed to seeing this through no matter what. And it's, you know, it's not just an opportunity to pass a law, but I think there's a bigger chance here to organize our voices as, you know, consumers, as people who just care about the healthcare system, to really, build an infrastructure that's fighting to improve our healthcare system here in Florida for a long time to come. Right now, there are, you know, several paths to expansion. And the issue, I think, is even though all of them are kind of it's a long haul. It's going to be a long campaign and difficult campaigns. But we know that this issue is kind of too important for us to completely abandon them. So today I'll focus on the work that we're doing on both the state level to hopefully pass legislation, but then also the work that's happening around the ballot initiative. So the effort to put Medicaid expansion, the question of expansion, on the ballot in 2024, and hopefully pass like we saw last night in South Dakota. So as we think about how we're getting this done in the legislature, I want to point out that our coalition working on that front is called Healthcare for Florida. So that's where a lot of our community partners are working together to think about how we can influence the legislature and how we can build more support in our communities for expansion itself. And, you know, our leaders right now in the legislature, they've been opposed to expansion for a long time. But I think our recent experience, what we've seen in North Carolina, where you've had the same kind of staunch opposition, we're seeing a lot of progress on that front. And I think it shows that even the staunchest of opponents can be won over. So as Healthcare for Florida, our goals for this year, and really for this upcoming legislative session in March, it's one, to secure bill sponsors, two, to really establish relationships with legislators and build a constant presence for the coalition up in Tallahassee, and also to demand at least one hearing of the bill, and finally to build broad community support across the state. So we all have a role to play, and as you can see here, there's some very specific ways you can engage with the coalition. I'll point one out, which is to say that for us, Florida Voices for Health, as a storytelling organization, the biggest ask we can make of you all is to help us identify even more stories and storytellers who can help us demonstrate just why Medicaid expansion is needed. And yeah, we're thinking about those who are in the coverage gap, who can tell their own stories, but also you all who might serve them in one way or another, serve that community, who can share your own perspective on why having coverage or providing coverage is so important. So I encourage you all to reach out to us, and we'd be happy to talk more about how we can capture your story and use that for the broader campaign. There are also a couple of easy ways. If you're an individual, to show your support for expansion, you can add your name to the thousands who have joined our sign-on letter at the Healthcare for Florida homepage, or you can be one of the folks who have shared their stories directly with us. If you're interested in doing and hearing more specifics about our plan, just go ahead and join the coalition directly. We have a monthly coalition call where we update on both the ballot initiative, but also where we kind of work collectively to think about what are some of those activities we can be doing in our communities to elevate Medicaid expansion. So consider us a partner if you're someone who's interested in hosting community events or creating flyers, collateral material, stuff like that. We're here to really work with you all as partners. So, I'll try to do this next part a little bit of justice. We have our campaign manager for the Florida Decides Healthcare effort, who's really helping to lead it. I'll start off by saying that Florida Decides Healthcare is the official entity that's running the ballot initiative, right? In Florida, it has to be run by a PAC, and this is the PAC that the coalition of folks has established. Now, the ballot initiative, like Dr. Moron mentioned, it's been an effort that's run into a lot of legislative barriers, court delays, and a pandemic. But there are a lot of things that give us hope and allow us to keep pushing. Not the least of which is that in 2019, and primarily with a volunteer effort, I should say, we collected enough signatures to like trigger the second stage of the ballot initiative process, which I'll dive into in a second. But after we triggered that review, the legislature passed the bill, making ballot initiatives harder. And then there was a question of whether or not we qualified under the old rules, which, you know, it was a little bit easier to be successful, or whether we were subject to the higher standards that the legislature passed in 2020. And then COVID hit, and then, you know, the courts closed, and that effectively killed our timeline for a 2022 ballot. Now, despite losing the ability to count any of those old petition signatures, we're pressing ahead with an effort to get this on the 2024 ballot. So for you all who want to be more engaged on that space, again, I'd encourage you to join our Monday calls, where our campaign manager, Jake Flaherty, joins us joins us for those calls and kind of debriefs everyone on the status of the campaign. But if you want to know more, again, just reach out to me and I'll be happy to plug you in and kind of get you started. But just to give you a little more background, to make this happen in 2024, we need to collect nearly 1 million signatures under the new thresholds. Now, the actual total that we have to collect it's a tick under 900,000, but we know that with the rate of rejected petitions, we'll probably have to collect over 1 million just to be safe. Now, importantly, these petitions have to be collected from 14 of the 28 congressional districts. Now, a second ago, I talked about how we triggered a Supreme Court review the last time around. The way it works in Florida, you have to begin the process of collecting signatures and collect 25% of that 800,000, 900,000 total before the Supreme Court will review it. And it's at that point, they'll tell you whether or not you've met the standards, right? Whether or not your language is legally acceptable. So that's to say that there's a scenario where we collect over 200,000 petitions, we trigger a Florida Supreme Court review, and then they tell us that the language is bad and we're forced to start all over again. Now, that's a terrifying prospect, but what I'll say is we've worked with some really good lawyers, the top constitutional lawyer here in the state, who's actually leans conservative, and he's very confident. We're very confident collectively, just all the eyes and stuff that we've had on the petition language itself, that once we get to that point, we're very confident that we won't be sent back to zero. So yeah, just to ease anyone's fears there. So finally, kind of assuming that we get past a court review, that we get all 800,000 signatures that we need, we have to get those signatures submitted and approved by February 1st, 2024. You can review or take a look at the petition at the link below, but I'd also encourage you to go to the Florida Decides Healthcare website, where we have a lot of resources set up for folks who want to start collecting petitions on their own. The good news is that we have started our volunteer signature collection. To collect as many signatures as we're going to need, it's definitely going to require paid signature collection. But as we ramp up, I know Jake is working to rebuild the volunteer infrastructure that we've had in 2019. And honestly, just in the 3 or 4 weeks that we've been volunteer signature collecting in earnest, folks have done a remarkable job. There's just been a lot of energy, and I know people use this early voting period to get out there and start meeting people at community events and things like that. So it just makes me happy, gives me a little bit of hope to see that there is that energy still on the ground. But I know what you're all thinking. How much is this going to cost, right? At the end of the day, to do a ballot initiative, it's a very expensive proposition, and that's what we're going to need to keep this thing going. And I'll tell you that it's going to cost double digits, millions of dollars. So at least $10 million is what we're thinking. And the coalition is working really hard to raise that amount and have had some success so far. It's harder to get, any more specific in a setting like this, but I would encourage you to stay plugged in with the coalition, join us on those calls and things like that. And that's a place where you can get a lot more plugged in on some of the details. So right now we're focused on driving small dollar donations, and we're pitching those stakeholders with deeper pockets to help us get there. So if you think you can be helpful with any of this, right? Whether it's signature collection, or maybe you're at home with $10 million and you're like, I have this money burning a hole in my pocket and don't know what to do with it, feel free to reach out and I can help you with that. So yeah, beyond volunteering, I think the biggest way anyone can help is just talking to your friends, your families, your neighbors about Medicaid expansion. Help us get the word out. We know people care about healthcare, and it's consistently top, like the issues for voters as they go to the polls. So we know how important it is for Floridians. I really want to thank you all for taking the time to listen, to stay engaged. Please feel free to reach out with any questions or thoughts. We'll answer some here, but yeah, if you just want to get a little more plugged in with the coalition, you can do that with me. And we have our new advocacy director, Acadia. And yeah, we're just really looking forward to partnering with everyone. Thank you.
Thank you so much, Scott, for such a wonderful presentation, and Dr. Moron as well. And thank you for your patience throughout these technical difficulties. We did receive a couple of questions from participants who RSVP'd. I would like to share those. The first one was, and you went over this in depth, Scott, but maybe if you could break it down to a few bullet points. What do we need to do to get Medicaid expansion in Florida? So what would you say are the most essential steps that somebody could do?
The first thing is getting the legislature on board. If, like, at the end of the day, we're going to need their buy-in on some level, whether or not the ballot initiative passes. But I would say it's getting those folks to come around. And the only way we're going to do that is if they feel pressure from the rest of us, right? So if I had to boil it down to the simplest thing, it's rallying as many of your friends, your families, your neighbors, right? To start talking to legislators, let them know that this is important to you. Now, assuming, politicians politic, then we kind of have to take the issue into our own hands and work on a ballot initiative. And I shared a couple of those ways you can get involved, but really just partner with us. And as long as we're all working together, I'm confident we'll get there one way or another.
Great.
Allison, can I add just one quick thing to what Scott said about one quick thing that people can do, and that is that, make it relevant. We have 1 million people in the gap, but we have way more people who do have health coverage, and they may just ask the question, why should I care? It's only a small portion of the population, but using some of the ammunition that we have received here from Scott and Dr. Moron, in terms of the fiscal impact of people not having access to preventative care and regular checkups and things like that, ending up at the emergency room, that comes at a really, really, really high cost in terms of the health of the people, our families, who are not covered, but also on the coffers of our local governments and our public health systems, the local level, as well as, the money that Scott mentioned, which is only the tip of the iceberg. I know it's a lot more, once you accept the money, the state has to match it. And that would be a huge economic boost to our local economies. And so, becoming involved with the campaign also means, learning the narrative of how Medicaid expansion can impact us at the individual, family, and community level, even if we do have healthcare coverage already, right? Like, there are so many ways, so many stories that have been shared. And, the work of the coalition, and in particular Florida Voices, has been really, brilliant. So become involved, know how to talk about the issue in a way that brings others into the campaign, that generates, that volunteer army, that infrastructure that Scott is talking about. That's going to be really key to get all those signed petitions.
Thank you. And Dr. Moron, do you have anything to add?
Yes. Regarding my presentation, So basically, I covered the emergency department visits, but sometimes the medical condition of the patients require admission into the hospital. And so this add more money to to the insurance, or if they have, or to the Medicaid. So the money that has been paid by Medicaid when some of these patients are admitted into the hospital is more than the money that has been spent with emergency department visits. So this, as I said before, this is not an effective way to spend public funding. Thank you very much.
Thank you. We also received a second question. They wanted you guys to expand, this individual wanted you guys to expand on LTC coverage and expanded HHA benefits. Are either of you able to speak on that?
What's the question about it? Or is there like a specific question around them?
No specific question. They just wanted you to expand on it a little bit.
So yeah, that's a tougher thing to talk about in like detail, but we do have some resources on our website that I can share, and maybe we can send out just like a presentation we did on it. Yeah, a little while back.
Excellent. Yeah, we can. I'll share those resources that you guys have with the participants afterwards. And those are the only questions we received. I want to open it up to participants. If you guys have any other questions for our amazing presenters, this is the time to ask them. You can put them in the chat box.
And once we send out the recording to the community, we will, I'm sure, get additional questions, and we will relay it to you, Scott, and Dr. Moron.
I just wanted to connect one thing to, to last night and, the varying positions and feelings about the, election results. People on both sides of the aisle may feel either, really positive or really negative about the results, depending on, where they stand on the candidates and the issues that they represent. But this ballot initiative is one way in which people power can basically be the determining factor, regardless of who is in office. And this is one way in which we can say, regardless of who is in office, this is something that we really need in our state. This is something that our families can benefit from. And it's really up to us, to talk about it, to get more organizations involved, create those hubs, rebuild that infrastructure, and go out there and start collecting petitions. It's a way that we can, reclaim the power of the people, regardless of who is in office. And I think Medicaid expansion is something that's going to benefit everyone, regardless of whether or not you have coverage. But we have to go out there and make those arguments and think of democracy, from a different angle, not only in terms of political parties or candidates or incumbents or, whatever the case may be, but also what is important to us as people. And this is also something that people can participate in, regardless of their voter registration status, whether they're a citizen or a resident or even undocumented. Everyone can contribute to this campaign. Everyone can go out there and talk about it and collect petitions. So I just think this provides a really great alternative for us to exercise our rights in a democracy, like power to the people type of stuff.
Thank you, Camilo. We did receive another question. Thank you, Debbie. She mentioned a question that was asked in the previous Zoom link, and it had to do with sedation and dental services, and how it's difficult to receive these services. Are either of you, would you like to comment on, solutions to this, this issue?
I'll say quickly that one of our initiatives as Voices, we've recently taken on the work of helping to lead the Florida Oral Health Alliance. And that group is kind of, as we're pivoting towards how are we moving to action, like how are we helping to improve outcomes, we're focusing on 3 buckets of work. One is policy change. One is provider cultural change is what we're calling it. So how are we kind of disseminating best practices among providers here in the state, but also community outreach and education. So what are those things that community members and patients need to know and understand to be better advocates for themselves, but also to achieve better health outcomes? And I think the question asked about sedation is something we see quite a bit, particularly for those Floridians with disabilities. So yeah, I'd encourage if it's something that you're interested in doing more. Is that Deborah Dietz had asked maybe, who's one of the bigger voices in this space in the state? Yeah, it'd be really nice to have you and your perspective at the table with us as we start to put together a strategic plan to address these things. And that feels like one of those issues. It'd be really nice to have that represented at the table.
Yeah, hi, we've met before.
Yeah.
It's something my organization cares about, but it was just a question that was typed last time that was lost.
Okay.
When they reopened the Zoom. So I wanted to make sure it got added to the recording. But yeah, we can connect and continue to discuss it.
It's good to see you, Deborah.
Thank you, Scott. Dr. Moron, do you want to comment on that?
Well, regarding to sedation services in adults, Florida Medicaid covers, for example, the following emergency-based dental Medicaid services. Medicaid cover limited exams, X-rays, dentures, teeth extractions. It should cover sedation and problems focused on care and pain management. But it's very limited, but and that's why we're having all these discussions.
Thank you. And thank you, Debbie, for remembering that question and putting it into the chat box. So we are a little bit over time, but this was an amazing conversation. It was too good to cut short. But we want to thank everyone for participating today. And thank you to our presenters, Dr. Moron and Scott. This was super informative, and hopefully we can have some more people who really want to get things going with Medicaid expansion and contribute to the work that you guys are already doing. So thank you for your time and sharing your expertise with us. And we will send all those resources that were previously mentioned to our participants and those who are RSVP'd. And again, thank you. Have a great day, everyone.